Welcome to the Orlando Health Emergency Medicine Residency Program. It is my honor and privilege to serve as a program director for an outstanding group of residents and a team of dedicated faculty. There are several unique aspects for our program that I'd like to share and hope that you have the opportunity to observe. The clinical experience that we provide is truly outstanding. Our ED is a level 1 trauma center with the highest trauma volumes in our state and amongst the top 10 in the country. As a comprehensive stroke center, cardiac center, burn center, and cancer center, we see and treat a broad range of illnesses across a diverse patient population. We're home to one of the few level 1 pediatric trauma centers in the state of Florida. Our pediatric training is truly unparalleled. I promise you that you will finish your residency with a wide array of experiences and tremendous procedural proficiency. As a program, we are also committed to advancing the field of emergency medicine in educational and clinical practice. We tailor our educational experience for adult learners, offering a blend of didactic lecture, interactive hands-on learning, simulation, procedural labs, team training, journal club, and case-based foundational learning. We're also dedicated to research in our field, and we serve as a hub for NIH-funded projects which advance the field of emergency medicine. Recently, we became the first emergency department in the world to develop and utilize an FDA-approved point-of-care blood biomarker for assessing patients with traumatic brain injuries. And finally, our program culture is very strong. With nearly 4 decades of experience in training emergency residents, we cultivate teamwork, camaraderie, problem-solving, and confidence. We encourage and prepare our residents to be leaders in our field. Most importantly, we cultivate a love of the field of emergency medicine. You will find that we all really enjoy what we do.
The commitment as a residency training program is not only to improve your education, give you that foundation of knowledge that's required as an emergency physician, but also to help you develop as a physician further by combining the sort of academic environment with the clinical expertise. We're providing you with the best opportunity to have a long career.
This program is unique because it's everything. It has academic, it has a little bit of community, a little bit of county, and I think that is what just makes it a powerhouse and what attract most of the residents to this program.
One of the things that we are most proud of at our Orlando Health Emergency Medicine program is our pediatric experience. So not only do we have 1 month where the interns spend an entire month working their shifts in the pediatric emergency department, but we also have at least 30% of our shifts each month, so you get longitudinal care throughout the different seasons and different disease patterns. We are very lucky to have Central Florida's busiest pediatric trauma center, level 1 trauma center here in Orlando. So our residents get exposure to high volume, but also high acuity. So the sickest patients will come here for both tertiary care and trauma.
So in our pediatric training, we have opportunities to do every sort of procedure. Every other day, it's either the fellow or the senior emergency department resident that gets the head of the bed and all the traumas. So you're getting to do pediatric airways. If a child needs a central line, you get to do that. Lumbar punctures on newborns that come in with a fever.
Our residency program is deeply ingrained into the pre-hospital system here in Orlando and Orange County. We're embedded in every part, beginning from the ground EMS, air EMS, event medicine, and mass casualty response. And we have one of the first accredited EMS fellowships in the country. We are a safety net hospital for our community, but we're also a tertiary referral center, a comprehensive stroke center, a PCI center for people having cardiac arrest or for having myocardial infarction. One of the other things that is unique about ORMC and our location here in Orlando is the 70 million visitors that come to Orange County every year, bringing us people from all over the world that come here, and we're able to care for them when they have emergent problems.
We are part of a unique research network called the Siren Network, which is an emergency care research network. Very few sites around the United States were selected to be part of this group of researchers, and we were selected. We have multiple research projects that go through this network, and we participate and we get our fellows and our residents and our faculty involved. So it becomes a real team effort to conduct cutting-edge clinical research.
The 2 situations that we focus on in the simulation lab are getting really good at the things we do every day, like STEMIs and stroke alerts, and also learning about things that we might not get to see very often. A perimortem C-section, or a patient who has an unusual illness like thyrotoxicosis. so that residents get the opportunity to practice those things, even if they don't encounter them in a clinical environment.
The goal of our program is not just to train excellent emergency physicians that are clinicians. We want them to be leaders in the field of emergency medicine. I think the most important difference between us and other programs is that we understand that the way people learn, what people need, change over time. Millennials are not baby boomers by any stretch of the imagination. Our program enables the trainee to have a substantial amount of input into how everything within our department is conducted, from clinical shift hours to academic conferencing, using newer techniques of group learning, off-site learning, individual learning, whatever it takes to accommodate the perceived needs of our trainees. And we give them the authority to impact our program.
Our graduates really help progress the field forward, and you see them in major leadership positions throughout the country.
What makes working here such a great experience is the people we work with every shift and the community of people we serve. I thoroughly enjoy working with our residents, nurses, and the entire ED staff. It's always a team approach, and that is what makes working here such an incredible experience. As for the people we serve, ORMC is located in a diverse community, which means we care for a very diverse patient population. Our patients are from all walks of life, and they come from different racial, cultural, and socioeconomic backgrounds. This makes for a provider who is well-rounded, with the cultural competence and ability to deliver equitable care that meets the linguistic, cultural, and socioeconomic needs of our patients. Our institution is always growing and stays progressive in our medical community. We have 4 major hospitals, all on one campus. Arnold Palmer Hospital, our hospital for children, Winnie Palmer Hospital for women and babies, Orlando Regional Medical Center, which caters to our adult population, and our most recent addition, Jewett Orthopedic Institute, the first of its kind in the state of Florida. Arnold Palmer Hospital and Orlando Regional Medical Center are both Level 1 trauma centers, the only Level 1 centers in the Central Florida region. Both trauma departments were recently renovated with state-of-the-art equipment and technology to meet the increasing needs of our community.
Whenever I'm talking with a fourth-year medical student who is interviewing for residency, I always tell them to go with their gut, but your gut's going to tell you Orlando Health.
Our graduates get help in finding some of the most competitive jobs, becoming leaders, fostering their professional growth, and having long and very successful, happy careers in emergency medicine. And on top of all of that, the bonus is that we're located in Central Florida, which happens to be one of the nicest places to live, work, and travel.
I'm thankful I came here because I can't imagine not being a part of the Orlando Health family.
If you really want a family, this is the place to be.